This is a talk on Chapter 6 and Chapter 17. Chapter 6 is Culture and Health, and Chapter 17 is Science, Technology, and Global Health. So we're going to talk about the relationship between culture and health, discuss some of the theories of how health behavior changes, and then assess the potential for technology and ways that technology changes would help public health nurses to improve health outcomes. So culture is related to health behaviors. It's an important determinant of how people perceive illness and whether they perceive that they can make changes or not. Culture affects how they use healthcare services, who they trust, and different cultures we know have different health practices during birth, after birth, when ill, and with fever and things like that. The concept of culture means the behavior and the beliefs that are learned and shared. And we know that culture influences families and social groups, art, the economy, politics, and so all of those factors then are social determinants of health as well. And we know that health policies and programs always have to keep culture in mind, that we cannot address every community in the same manner, that when culture is at play, public health nurses have to adapt to the culture and approach the community in a culturally sensitive way. I wanted to bring out that there are folk illnesses, and these are interpretations that people are in a physical state that they perceive to be an illness, but there's not a virus or a bacteriological cause, but there is some effect that is being had on the human, and so we have to take into account those beliefs, because if somebody believes that they're turning yellow not from hepatitis A or from malaria, but because somebody put a spell on them, we have to be able to incorporate that belief and then work to incorporate the Western medicine that's required. We know that there are taboos about certain foods, about bathing during different times in life, and so again, we have to be aware of those with the different religious and cultural groups. We know that people will first try a home remedy. We in the United States do this as well. We'll try a hot toddy or some warm tea, and if that doesn't work, maybe we'll go to our grandmother or a local healer, and then we will go to a doctor's office. The cost of medical care does affect when people will use it, and in some countries the providers, the physicians, are often viewed as a social class difference, and so this may affect the trust that develops between the provider and the public health nurse, and between the provider and the patient. And so the public health nurse can be the go-between, because public health nurses who are in the community, working in the community, are seen in a different way than a physician that is in an office. We've seen these before, and how can these unhealthy behaviors be changed? Taking culture into account, public health nurses will plan programs promoting nutrition during pregnancy for small children, not going to sleep with the bottle so that the teeth are affected, no tobacco use during pregnancy, unsafe sex, things like that. All needing to take into sensitivity to culture. The ecological perspective now, these are getting into the theories of how to change health behaviors, and I want you to read them when you're in your textbook, because the part of the bachelor's degree in nursing is that we begin to look at the theories that nurses use and apply them to people's behavior. And so the ecological perspective is that the social environment will affect people's view of health and the behaviors that they will complete. This is on page 151. These are the the concepts related to the ecological perspective, and so I want you to take a look at that and read through the chapter about the ecological perspective and how public health nurses would use this information to motivate people to change. The health belief model is another way that public health nurses can look at how people will start to make changes. So people look at their perception of the likelihood of getting an illness. So they say, oh, I don't have breast cancer in my family. I'm never going to get breast cancer, so I don't need to go for a mammogram. Well, as public health nurses, we know that that is not true, that there are cases of a person getting breast cancer when it was never in their family. And so we want to look at how we can get that person to begin to engage in behaviors to prevent diseases and promote health. And so we want them to reach self-efficacy and feel that they can carry out the behavior. So again, the change model is on page 152. Take a look at this for the different stages: pre-contemplation, contemplation, decision and determination, action, and then maintenance of that behavior. And this is the health belief model. So get to know that, because it can work for your patients that are, if you're working in a hospital or in a long-term care facility, it can work for those places as well. The Diffusions of Innovations model is a communication model, looking at how communication will promote social change, and that when a message is in a community for a while, it's taken in by the groups, and they will begin to think about it and make adaptations. We need to understand that behaviors require an assessment of what is happening, the extent to which those behaviors can be helpful or harmful in working towards health, what are the underlying motivation of these behaviors. We know that weight loss, motivation for weight loss is important when a person is overweight and obese, but if a person is normal weight and begins the motivation to perfection, then we can see anorexia nervosa develop. And so we want to make sure that we're looking at the motivation behind why somebody is doing something in a supposedly healthful way. So methods that public health nurses use to change behaviors include community mobilization, so cleaning up a park so that people can go to the park and exercise, mass media messages, public service announcements, social marketing. On YouTube, there's all kinds of programs about eating more fiber and things like that. Health education by public health nurses, by the CDC, by the YMCA, programs that promote health, by hospitals as well. Cash transfers can be offered. There have been instances when countries have offered families money for vasectomy so that population is controlled in a way. And then changes in policies. And we know that these can be effective, but they can have a backlash. Philadelphia is under the soda tax rule, and the idea is to tax soda high so that people won't drink it. And so I'm not sure what the status is of how effective that has been. But there are other policies that promote healthy behaviors. So now this is chapter 17, talking about science, technology, and global health. And we know that progress has been made and improvements have been made in vaccines, in medications, in antibiotics, in in medical devices. And we knew that these products can help us, but they're not necessarily good in the long run because they may be expensive for some countries, or there can be countries that then can't maintain the technology. The most important target groups are for poor people. Injection safety. We know that in some developing countries, medical supplies are hard to come by, so they reuse needles, and we need to make sure that they're cleaning them properly, or we need to make sure that they're disposing of them properly. We know that transport and the storage of goods, the supply of electricity, we know that all of these can affect vaccinations, can affect medications, can affect how people live. And so we need new products to make storage safe for vaccines especially. So when we look at the need for new products, the ideal characteristics for diagnostics such as the screening tests, we want to make sure that screening tests are specific and sensitive, meaning that the specificity and sensitivity are telling us the true positives and the truly negative cases. We want them to be inexpensive. We want them to be easy to use. We want them to be safe and heat stable. With drugs, we want them, again, to be safe, effective, inexpensive, have a long shelf life, and be easy to use by the patients. We want vaccines to be safe and effective and inexpensive, and require only one dose for lifelong immunity. That's in our future. You never know. And also, vaccines need to be easy to transport, need to be heat stable, and not require refrigeration. That's a very delicate, we have some very delicate vaccines right now, have to remain frozen and then given within a certain amount of time, have to maintain refrigeration. There's a lot of effort and a lot of money spent maintaining that refrigeration, and some countries cannot maintain it, which then can affect the vaccine stability. And so those are some of the things that we're thinking of with the new products, and I'm sure that you have ideas in hospitals of other things that are needed as well, making people healthy so that they can return to the community. Thank you for listening.